Hello, my name is Brian Clay Young, graduate student at Auburn University School of Nursing. This is my health assessment video for NURS 7116, Intro to Health Assessment, and this is my patient. The first thing we're going to do is assess vital signs, height, and weight. We've established those already. She would prefer that I not give her weight, so I won't do that today. I'm going to first inspect the hair, scalp, face, and skin. I'll look at all of those. Everything seems to be intact initially. I don't see anything abnormal. Then I'm going to palpate the head along with the sinuses, frontal and maxillary. Okay. Then I'm going to palpate the temporomandibular joint, testing for crepitus or any abnormal findings upon palpation. Those are none. Everything seems intact there. Then I'm going to determine the patency of each nostril. I'm going to have her tilt her head back. I'm going to look inside the nostril. While I'm doing this, I'm also inspecting the mucosa, testing the patency of the septum, also looking to see if the turbinates are also intact, and they all do appear to be intact. Then I'm going to inspect the lips, the buccal mucosa, gums, teeth, roof of mouth, and tongue as well. All right, let's get tongue out. All of that looks intact there. I'm going to determine the alignment of the eyes, covering each eye and testing light reflex of each eye. Both pupils are reactive. There seems to be no abnormalities there. I'm also going to inspect the eyebrows, eyelids, the conjunctiva, sclera, cornea, and iris. Nothing seems abnormal there. Then I'm going to move on to the ophthalmoscope exam, where then I will put my hand on her head and take the light. I will take, with my left eye, I'm going to examine into the left eye, positioning the light as needed. I will be able to then assess the fundus, vessels of the eye, and the disc. The left eye seems to be normal. I will then go over to the right eye, do the same. I will use my right eye this time to examine. I'll adjust the light and look into the eye, assessing all of those as well. Everything seems normal there. Then I'll move on to examine the ear, where I will first inspect the auricle and palpate, testing to see if there's any type of irregularities there. There doesn't appear any. Then after that, I will perform the otoscopic exam and look into the eye. I will insert, after putting the probe cover on, I will then go to the ear, lift the pinna slightly, looking into the ear there. The left ear does appear normal. I will go on to the right ear and do the same. That also appears normal as well. There doesn't appear to be any abnormalities. Then I will test for lateralization by doing both the Rene and Weber's test with my tuning fork. This will be done by placing, creating a vibration noise and putting it behind the mastoid process. That will be the Rene's exam, which I will do first. Put that in on the mastoid process, and I'll test outside of the ear. Which one was more pronounced to you?
The second one.
Which would be normal. I will then go on to the right ear, where I will do the same. The second is more pronounced. All right. Both the right and left ear are normal. Then, after that, I will then go to the cranial nerves after we've inspected the head. The first thing I will do is check cranial nerve number 1 by assessing sense of smell. When I place this under your nose, what do you smell there?
Alcohol.
Alcohol. If she couldn't smell or could barely smell, I would ask her if she had any type of history of head injury, ask her if she smokes, if she had recently stopped smoking, and the light, anything that might affect her sense of smell. I'll then go to cranial nerve number 2, where I will actually assess the visual acuity. I will place a chart in front of her. Let's just say, for example, what can you see on that table right there?
Books.
Books, so she can see. I'll then go on to assess the visual fields, and I'll place something in the periphery from about 2 feet apart. I will have her look in 8 different areas to see if she can see. What do you see there?
Pen light.
Can you see it there?
Pen light.
How about there?
Yes.
And there?
Yes.
Okay, that's on the left side. I'll go to the right side and do the same thing, using sort of a H type motion, if you would, to cover all 8 fields. You see it there?
Yes.
How about there?
Yes.
There?
Yes.
How about there?
Yes.
Yes. So, at least from the outside, the visual acuity looks good. She can see the pen light from 8 different areas. I will test her pupillary response next, and this will be cranial nerve 2 and 3. I'll just come from the outside, going in on each eye. Her pupils do respond, and they are reactive to light. Then I will test extraocular movements. This is cranial nerve number 4, 3, and 6. I will start from the outside. Tell me when you see something.
No.
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 No. No.
It does appear the extraocular movements are intact. Then I'll go on to test cranial nerve number 5. I'll palpate the temporal and masseter muscles while she clenches her teeth. Clench your teeth here for me. All of those muscles seem to be strong and intact there. Then I'll also test for pain sensation in these areas as well, to be able to, as a secondary test to cranial nerve number 5. This will be accomplished by just using a pinprick. I don't want to create blood, but you feel there,
Yes.
there,
Yes.
there,
Yes.
there. All right. And then I'll go to this side as well. You feel?
Yes.
Yes, yes. Sharp sensation or pain sensation is intact there. I'll also go to light touch. Light touch, I'm going to use the end of this Q-tip here. And when you feel?
Yes.
Yes.
No.
Yeah.
Yes.
Okay.
Yes.
Right here.
Yes.
Here.
Yes. Yes.
All right. And then we will have the patient see if she can feel light sensation also with this cotton. Can you feel that?
Yes.
Can you feel that? There.
Yes.
There.
Yes.
All right, very good. Then next, I'll have the patient raise her eyebrows, frown, close both eyes, and frown. You smile, close both eyes. Don't let me open them. Don't let me open them. This will be testing cranial nerve number 7. Also, just have you blow out your cheeks. Won't let me push all the air out. Very good. All right. Then we'll assess auditory acuity, and that's a part of cranial nerve number 8. We can just do this very simply by just, we want to make sure she can hear something from the outside, so I'll also use my tuning fork for that. Let me know when you hear something.
No.
You hear? Very good.
No.
There we go. So that appears as though cranial nerve number 8 is intact. Then I'm going to do 9 and 10, which will be testing movement of the uvula and engaging in gag reflex. I will accomplish this by using a tongue depressor. I will have you open, stick your tongue out, shine a torch in there. I see the uvula is intact. Gag reflex is also intact. And then cranial nerve number 12 is very simply testing movement of the tongue. How you stick your tongue out, side to side. And cranial nerve number 12 seems to be intact as well. Cranial nerve number 11 is accomplished by testing the trapezius and sternocleidomastoid muscles. So I'll have you kind of clench your neck like this, like a frog. Yep, that's there. And I'm going to push down on the trapezius. Push against. Cranial nerve number 11 is intact. The last ones, which is 5, 7, 10, and 12, Those are just very simply accomplished by listening to the patient's voice, making sure they can articulate their words, and through this exam, she's been able to speak to me, so those cranial nerves seem to be intact as well. Next, I'll move on and inspect the neck. I'll look first to see if there's any abnormalities. So I'm straight, I don't see anything. Then what we're going to do is test for flexion, extension, rotation, and lateral bending. She just had a little flexion there, but we'll first flex by moving the head forward, then extension. We'll do lateral bending by there. There's good flexibility there, and rotation. And the neck seems to be good and strong. What you want to do next is palpate the lymph nodes, the occipital, post-auricle, pre-auricle, the retropharyngeal, submandibular, anterior cervical, and supraclavicular. Those are all here along the back of the neck. We're going to be testing there. Those post-auricle, periauricle, going all the way down back through the occipital and coming down through the back of the neck and checking those. Carotids, there doesn't seem to be any swollen lymph nodes. Those are all intact as well. Next, we'll want to palpate and also take the carotid arteries. And while doing that, we'll also palpate position of the trachea. So first thing we'll do is right here where the carotids are, I'll have her bend her neck back. Look, the trachea does seem to be in place. The carotid arteries first we'll palpate. We're assessing for any bruise. Well, bruise we'll do an ear exam, but any thrills, there's not any there that I can feel. We'll move on next to listen to the carotid arteries to see if there are any bruise that can be auscultated. And I can't auscultate any on exam. We'll observe the external and internal jugular pulsations with the patient appropriately positioned. So what I'm going to do is lay her back just a little bit there. I'm going to remove the pillow just for a moment. Just bring your head back. There does not appear to be any jugular vein distension on exam, and just by looking there, so I'm going to raise your head up here again. Sorry about that. Next, we'll want to inspect and palpate thyroid gland. I'll look here, straight forward, palpating. I don't find any enlargement of the thyroid gland at all, so that also seems to be normal. We'll next go to the chest. We will inspect the skin, posterior thorax, and also observe respirations. I'll have you sit up here for me just a moment. Just having her sit up normal, just observing her respirations, and from the posterior thorax, I don't find any abnormalities. Her respirations are regular. There seems to be an even rise and fall of the chest cavity just on observation. Next, we'll assess for respiratory expansion by properly placing my hand over the 10th rib, and we'll look to see how symmetrical the movements are. I'll start here in the front, come right below there. Have you take a deep breath. There does seem to be an even rise and fall there. I'll come back and do the same thing here. Okay. Does not seem to be any abnormality of rising and falling of the chest. Apologize for that. Then I'll assess tactile fremitus by asking the patient to say the number 99, both from the bases and also the front part of the lung from the bases up the apices. First, I'm just going to have you say 99.
99.
99. Okay. We do the same thing here. 99.
99. 99. 99.
Okay. Then I will cuss the lungs, and just comparing, listening for resonance. We'll do that also from the apices of the bases. The proper way to do this is you will want to use the middle finger of your dominant hand, placing this hand over the area that you're percussing. Here we're testing for resonance, making sure there's no dullness or anything that would indicate any abnormalities. It all looks normal there. We'll also percuss for diaphragmatic excursion as well, and making sure that with this dullness that there's full expiration and inspiration. That appears to be normal as well. Then we'll also auscultate the lungs in all lung fields to make sure there are no adventitious sounds. Go all the way down to the bases, and then listen here from the front as well. Then the next thing I'll do is test for CVA tenderness. This is tenderness of the costovertebral angle. I'll go right here just over the top of the kidneys using my hand, and then coming forth. You feel any tenderness there?
No.
Okay. Any tenderness there?
No.
And she's not tender in the costovertebral angle. Then we'll inspect the interior chest, just inspecting the skin, also respirations, thorax, make sure there's even rise. And there does seem to be, so that all looks good there as well. We also assessed for tactile fremitus from the front as well just a few minutes ago. Then we'll palpate for any thrills or pulsations, and we'll also palpate the apical pulse as well. Just to do a general palpation of the chest to see if there's any abnormalities there. There doesn't appear to be. We can palpate the apical pulse there. That's been done. Then we will, we've already auscultated the lungs. We did the percussion. Then next we'll auscultate the precordium in the proper place so that we'll be able to hear the aortic and pulmonic, second pulmonic, tricuspid, and mitral sounds. We'll do this systematically by using both the bell and the diaphragm. We'll do the mid-second intercostal space. Then move our way down here to third intercostal space, fourth, fifth, and sixth. Then we'll move to the diaphragm. Alternating the bell and the diaphragm is useful depending on what types of sounds you're trying to hear. Usually the bell is usually better for hearing bit deeper sounds. We'll go then assess the radial brachial and carotid and femoral pulses, rate, rhythm, and amplitude. We can just very simply accomplish this by going to the appropriate area. Carotid we would assess here. Brachial here. Radial here. and then femoral we would do here. Then we'll go on to inspect the abdomen. We would look as if here we would first look at the umbilicus, look at the skin over, we look for contour, look to see if there's any obvious masses or anything that would be visible just on exam. We're also looking to see if there are any abnormal pulsations. Then we will also take the abdomen in all 4 quadrants, and we would do that first. We would want to also take before we percuss or palpate the abdomen, because those can create abnormal sounds if there's none there. We'll do that first by going to all 4 quadrants by listening. Everything appears to be normal there. No abnormal sounds just by listening. The next thing we'd want to do after listening to bowel sounds, we would move on to the arteries, the iliac, femoral, and renal arteries, to see if there are any bruits. Put those over the proper areas here. The iliac would be here. You're not likely to hear iliac bruits at all. Then the renal, aortic, and then we would go to both sides to listen for femoral. We would want to palpate nodes, inguinal nodes, go horizontally and vertically, and then we would also want to percuss the abdomen. But first we'll go down and we'll palpate the nodes. We would start here in the pelvis, go down and over on both sides. Then we will percuss the abdomen. This is to make sure that the proper sounds are heard over the spleen, liver, and stomach. Then we would percuss and measure the liver over this way. We're coming up, making sure that the liver is in place with the proper dullness. Then the next thing we would do would be to test for abdominal reflexes. Then after that, we'll want to palpate the abdomen lightly and deeply so that we can easily identify the organs that we're looking for. These are primarily the liver, spleen, kidneys, and aorta. This is usually accomplished, I'm going to lower you down here a little bit, by using the fingers and going down in a light circular motion. While I'm doing this, I'm also just going to look. I'm also going to ask her if you feel any discomfort, and also watch her eyes and facial expressions to see if there's any painful expressions just on observation. I didn't see any of those. That all accounts are normal there. Next, we'll move on to the musculoskeletal exam. I'll inspect both arms for muscle mass, taking a look at the skin, and assessing capillary refill and grips. I'm looking at both arms here. Looking at the skin, I don't see any type of lesions or irregularities or moles. The hair growth appears to be normal. I'll assess capillary refill in each finger. Obviously, normal capillary refill would be 3 seconds or less. That appears to be normal. I'll also have her test her grips in both arms, testing for strength and extremity. Squeeze my hands. Good strength there. The next thing we'll do is assess the arm for both light sensation, pain, vibration, light touch, and we'll do that by using the proper instruments. Let me know when you feel.
Feel what?
Feel that? That's our light touch there.
Feel that.
Feel that?
Mm-hmm.
All right, let me know when you feel.
No.
Yeah, okay, very good.
Same.
See? All right. And then finally,
No.
feel.
Mhm.
Okay. Oops.
Feel that.
Okay. All right. We'll also then assess for stereognosis. I'll place an object in her hand, asking her if she can identify it for me. By putting this here, what do you feel there?
Coin.
Coin. Very good. I'll also test in the other as well. What do you feel there?
Coin.
Very good. All right. So that we've accomplished. We'll also test rapid movements and point-to-point testing. I can do this by having her reach out, reach my arm here. Point-to-point testing. I hope you touch my finger. Yeah. Touch my finger here. There. Okay. Use this hand. Very good. That way we test the reflexes there of the upper extremities. Then next, we're going to assess deep tendon reflexes of both the biceps, the triceps, brachial radial, patellar, and Achilles. Right, stop. The next thing I'm going to do is inspect the lower extremities. I'm going to check both legs, assessing the skin, muscle mass, hair distribution, also the venous pattern of the legs. Just from exam here, there seems to be a normal skin growth. There's no abnormalities of the skin. There doesn't appear any varicosities or any other abnormal findings of the vessels. I'm going to test the range of motion of the hip. I'm going to accomplish this by using abduction, adduction, flexion, hyperextension, internal rotation, and external rotation. First, I'll abduct. That looks like that. This way. Abduct. Then we're going to actually flex both hips. And then we will also check for internal and external rotation. We'll internally rotate here with this one and this one. Then after that, we will move to the knees. Inspect first. I don't see any abnormalities. Palpate here. Nothing appears to be abnormal there. We'll also test range of motion of the knees by flexion and extension. Then we'll move down to the feet. We'll just first inspect both the ankles and the feet to see if there's any type of abnormalities here. I can't seem to see any just by inspection and palpating. Also checking to see if there's any signs of pain also when I do this. We'll also check range of motion of the ankles and feet by dorsiflexion, palpation, and plantar flexion. We'll also rotate those out there. The next thing that we will do is also check for capillary refill of all of the toes there. And then we will, while we're here, also palpate the dorsalis pedis pulses and also the posterior tibial pulses on both of these. We'll also move up and we'll palpate the femoral pulses just to see if there's any type of abnormalities, any thrills, of any of that sort of thing. And then we will also test both legs for sensation of both pain and light touch. Let me know when you feel there. This is our light touch. Okay, very good.
Yes.
All right. And let me know when you feel.
Yes.
Yeah. Yeah.
Yes.
Yeah.
Yes.
And then we'll also go to Let me know when you feel that prick there for pain sensation. All right. And that all appears to be normal there. The next thing I will now assess the deep tendon reflexes of the biceps, triceps, brachioradial, and also deep tendon, as well as the Babinski reflex. We will test in each arm the brachial deep tendon reflex. I'll place my thumb here and then lightly touch. I'm testing for sensation and movement of the forearm. I would do that in both arms. Then I would do the triceps. I have her hold her arm out here. I'm looking when I touch here with this tendon, I'm looking to see if any movement of the arm. And there is. I would do that in both arms. Then to test for the patellar tendon reflex, I would go here just below the patella, lightly tap the tendon. I'm looking for motion here of the lower leg, and it's positive in both arms. I'm just going to have you just lie back here just for the edge of the bed here for me. The Babinski reflex can be accomplished by just taking an object, coming over the sole of the foot. There we go. Looking to see if that toe moves in. Next, we'll inspect the spine. I'll have you step forward here for me just a little bit. I'll just take a look here first to see if there's any abnormalities, and also test for scoliosis if necessary. She has no history. I'll then test for the range of motion, having her both flex, extend. We'll also do hyperextension and lateral bending and rotation. I'll have you bend forward there for me. There we go. No abnormalities. Want to bend and come back for me. And back this way. All right. Then I'm just going to have you just stand straight and then just turn with your shoulders. Very good. All right. And then we'll perform the Romberg's test by having her just stand straight up, both feet together. There we go. Close your eyes. I'm looking to see if there's any swaying. I don't see any. Then I would just have her just assess the gait. I'll just have you just walk this way, just tips of your heels in front of each other. There you go. All right, then turn back around and walk this way. Very good. And that concludes my physical exam. Thank you very much.